There was more to see than can ever be seen, more to do than can ever be done. Patience that can never be found. But with Talia high and ETG by our side, there is nothing we can't achieve on our round. Preservation of life until it's theirs for all. Through despair and hope, through faith and love, the path may not be straight, but our rope is binding. First do no harm, preservation of life.
Well, good morning, everyone. Glad to see you all here on time. My name is Dr. Mufasa, and I am the director here at Pride Rock Medical Center. And this is my wonderful advanced trainee, Dr. Zazu. Now, medical students, please remind me which one of you is the third year and which one of you is the fifth year?
Hi, Dr. Mufasa. My name is Nala, and I'm the fifth-year medical student from the University of Newcastle. Now, I know I've only had the chance to read 27 of your 117 Lancet articles, but can I just say I'm so honoured to be here.
Oh, please, Nala, the pleasure is all mine, and I'm so happy to see you already practicing evidence-based medicine. And how about you?
Hi there, Steve. Dr. Mufasa. I'm part of the new MD program, so this is my first time in the hospital. Well, not my first time. I was here 3 years ago, when I had my anal cyst drained.
Medical students? Oh, come down here, my favourite! Oh my God, I'm Dr. Zazu. Oh, it is so great to meet you guys. Oh, we have so much work for you around here to do. You'll be so amazing at everything. I can't wait to teach you about so many things.
Oh, and this is my sister, Dr. Scar. She's one of the surgeons. I think she joins my rounds just to be a pain.
Well, look what we have here. A fresh batch ready for the picking. Let me guess. Mother's a waitress, father's a teacher, lots of older sisters, big, happy, wholesome family. You're from the country, somewhere rural. Oh, of course. Armadale. You've had a good, easy life, haven't you? You started medicine because all you wanted to do was make your family proud and help people in need.
Wait, how did you...
And as for you, you're not exactly hard to read, are you? Your mother must be a doctor. Oh, and your father's a surgeon. But he's not in the picture much, is he? You're from Sydney, only child. Everyone had such high expectations. Too bad you never quite lived up to them.
Well, no, I'm not from Sydney. I'm from the North Shore.
Come on, Scar. You said you wouldn't do this with the new batch of students. Anyways, team, we better begin. Are we ready? Zazu, where are we off to first?
Right here.
Here, bed 17. Who do we have here? Mrs. Jenkins. Good morning, Mrs. Jenkins. My name is Dr. Mufasa, and these are my colleagues, Dr. Scar and Dr. Zazu, and these young people are our very bright future doctors, Steve and Nala.
Hello. How do you do?
I'm doing well, thank you. And how about you this morning? Are you finding it any easier to breathe?
Oh, no, not quite, but everyone's been so nice.
Okay, well, it's a pity to hear about your breathing. Mrs. Jenkins, please don't mind us. For the next 5-10 minutes, we're going to talk about you as if you weren't here. As if we were talking to, well, an audience. Mrs. Jenkins is a very lovely 72-year-old lady who presented to the emergency department yesterday with shortness of breath and bibasal crackles on auscultation. So, what could be the diagnosis? Steve.
Deconstipated heart failure?
I've been quite locked up, if you know what I mean. I think Steve means acute decompensated heart failure.
Oh,
Excellent work, Nala.
Now, great. Zazu, what are the differentials that we should consider in this patient?
Well, Mufasa, I guess our other differentials would be PE, pneumonia, COPD, and other interstitial lung diseases.
Great.
Oh, it could be a tumor.
No.
Oh my God, Mufasa,
Zazu,
she's got cancer!
No, Zazu, she's fine. She's fine. Don't worry. Scar, how should we manage this patient?
Well, let's see. If it was up to me, I'd slap her on the table for a cardiac bypass and let the resident get some surgical practice. What do you say, Zazu? Ready to spread those wings?
Me? Wings? Surgery? I've never even clipped my own toenails. How am I supposed to do any surgery?
Or I suppose we could stabilize her hair and optimize her medications. Thank you, Mrs. Jenkins. Dr. Zazu will be in later to check on you.
Hey there, Nala. I don't think I've had the chance to properly introduce myself. I'm Steve, and I'm the third year, I guess. We'll be working together this rotation. It's pretty exciting, huh?
Look, no offense, but every minute I have to spend looking after you is less time I get to spend with the actual patients.
I'm sorry.
Look, that came out wrong. I just really need to impress Dr. Mufasa. Here are some tips, so pay attention. Rule number 1, always walk within 2 paces of the consultant. There is nothing worse than a medical student who slows the whole team down. Number 2, come to ward rounds prepared. Your only use is to carry spare obs and fluids charts, so don't go anywhere without them. And finally, if anyone looks at you and says, "What are the obs doing?" just look confident and say, "Obs stable, afebrile."
Ob stable, afebrile. Okay.
Good morning. Now, who do we have here, Zazu?
This is Mr. Jaeger Bombarelli. He is day 3 of his admission for acute pancreatitis on a background of significant alcohol intake. He's improving from a medical point of view, but needs a bit more social work done before he's ready for discharge.
Okay, so Scar, what are the important issues to consider in this patient?
Well, let's see. I think his most pressing issue is that he's fat. Zazu can chase that up later. That reminds me, tomorrow's teaching will be on pancreatitis severity indices. Steve, what are his obs doing?
Ob stable, afebrile, Dr. Mufasa.
Great, moving on.
Thank you, Nala. How do you not panic when they ask you those things? I get too caught up in my own thoughts.
Well, what were you thinking about?
I was thinking about the patient mainly. Like, why is he drinking so much? Does he have any family nearby? And what was he doing?
You were thinking about all that.
Yeah? Wasn't everyone?
Steve, you're in clinical years now. You don't have time for that stuff anymore. Just focus on the patient's medical issues, not that fluffy, feel-good JMP crap.
Right, essentially this is another case of textbook appendicitis. The sooner we get him up to theatres to cut it out, the better. I'll start prepping him for theatre right away.
I don't know, Doc. It might just be food poisoning. I did have a bowl of MRSA for breakfast.
Okay, sir, try to remember that we're the doctors here, not you, okay? If it's all right with you, I'd like to skip that whole consent process. I mean, it's clearly in my the patient's best interest to proceed with the appendicectomy right away. Okay, sir, we'll get that appendix out soon!
Scar! You can't keep treating our patients like this. This man has a clear infective history and does not need his appendix taken out. Heavens above. Well, I think that's the end of the ward round for today. Steve, Nala, go take a long case and present it to Zazu afterwards.
Wait, but Dr. Mufasa, what is a long case and how long is it?
A long case is one of the cornerstones of medicine. It's this most beautiful union of medicine and art known to man, consisting of a thorough history taken from the patient and the performance of the correct physical examinations and the construction of a management plan that's based on your findings. Nala, take Steve with you and help him find a long case. Look around these wards. Everything the light touches is our kingdom. While you are on this placement, consider my patients your patients and practice taking histories and performing examinations as you wish.
All these patients are mine?
Yes, Nala. Everything the light touches.
But what about that shadowy place over there?
The drawer of the scalpel. I thought you would ask, Steve. Those are theaters. Needless intervention lies beyond our borders. While you are on this placement, you must not go there. Great work, Zazu. Keep it up. Scar, my office now.
Oh my god. I can't believe Mufasa liked my work that much. Oh, what a relief. I can't wait to go home and tell my cats about this. Long cases, yes. There's plenty of good long case patients over in Ward F for you. It's best for you guys to head over there.
But Ward F, isn't that the...
Geriatrics ward? You betcha.
Wow. I can't believe it. This is it. I want to be a doctor here, so freaking bad. Live out all the dreams I ever had. I'm gonna be a fixer of loads of disease. Greatest of these words I've ever seen. Oh, every time I close my eyes, I see me saving all those lives. Yeah, isn't pain extending life? Oh, I swear, and no one will compare to when I'm the doctor, yeah.
Oh, Helicobacter, need help with your stiffness, I'll take you the distance. If you got a lymphoma and it's a birkin, I don't know what I do, but hey, Mufasa can fix it.
I'll be careful with the legs, chest pain, I'll reduce it. With a pal to pal care, I can lessen your anguish. From infectious disease and curing polio, I can put your lungs at ease, kick on that peace. Oh, every time I close my eyes, I see me saving all those lives. Yeah, easy pain, extending life. Oh, I swear, no one will compare to when I'm disaster. Yeah, oh, I could be a billionaire. Oh,
Nala, what is this place?
This is the geriatrics department, Steve. It's a cold and desolate wasteland where many come in and only very few leave. They say that if you make eye contact with anyone, you are doomed to talk to them for all of eternity. We just need to go in, find someone who isn't confused, out of their minds, but still sick enough to be a good long case patient.
Okay, but how we got...
Did you hear something, doll?
No, Beryl, I haven't heard anything since 97.
Did someone say my name?
No, Beryl, I was talking to Beryl. No need to get your blood pressure back up again.
Oh, I've been backed up too, Beryl. Haven't moved my bowels in almost a week now. Not enough fibre in the hospital, Brett. That's why.
Dead? Did you say dead? Who's dead? Am I dead? My memory's not so good these days.
She's talking about the bread, Beryl. Where has your hearing aids gone again? That reminds me. Where has the nurse gone with that foot ointment of mine? Oh, you're very quiet over there, Beryl. I'm over here, Beryl. Just move both your eyes over when you look. I'm lying right here.
Dying? Who's dying? Am I dying?
No one is dying, Beryl. She was talking to Beryl in bed 4. She's been asleep most of the morning. Oh, let her rest. She's been like that since they brought her in. I guess I'll read my Women's Day until that handsome Dr. Mufasa comes back for my pulmonary exam.
Did you say pelvic exam, Beryl? Phew. I'd let that nice young Dr. Muhammad change my catheter any day.
Oh, Beryl. Oh. Keep your voice down, Steve. Or do you want to get stuck explaining where you're really from?
I'm sorry, Nala. It was an accident. I didn't know.
Okay, it's your first time. Now, we need to find a nurse. Only they know who the good long case patients are. The trouble is they are always on tea break.
Maybe I can go find them? I don't know. Where do they usually have their tea break?
No, Steve. You never know who or what lies around each corner in here. We need to find a way to bring them to us. Got it. Oh no, Steve! Look at this! One of the doctors has left the workstation all dirty!
Did someone say...
Workstation? Dirty? Doctor's dirty in the workstation? Which one of you did this? It wasn't us. Well, it was fucking one of you! Disgusting! No, I just saw the doctor who did it run out of the ward. I tried to run after him, but he was just so fast. He didn't even gel his hands as he left. No hand hygiene? What insolence.
I've heard enough. I'm calling the numb.
Oh, no, please don't call the numb. I'm sure she has much more important things to do. How about Steve and I clean this up for you? Would that help?
Just don't let it happen again.
Of course it won't happen again. But you know, while you're here, would you happen to have any good patients for Steve's first long case?
Of course. Welcome to Ward F, Steve. Sorry about all that. Some doctors just seem to think that they can walk all over us. We only have one rule around here. You respect us nurses, and we will do the same to you.
And always practice good hand hygiene. Any questions?
Yeah. What's a numb?
The NUM is the nursing unit manager. They are the most important person in this ward.
She is very busy though, so we only call her in emergencies.
If you chant your name 3 times into your stethoscope,
she will appear immediately. But this is dark nursing magic, and should only be used in times of grave peril.
So what's her name?
Her name is...
Is that nurse back with my foot ointment?
Yes, I've got your ointment, Beryl. Just give us a minute.
Did somebody say my name again?
Go and talk to Beryl over there in bed 4, Steve. She's quieter than the other 3. She's an 87-year-old lady who came in yesterday with a history of fever and some urinary symptoms. The rest is for you to find out.
Time for tea break!
All right, Steve. You must always start a long case by introducing yourself and gaining consent.
Okay, easy. Hi there, sir. I mean, ma'am. I mean, Beryl. My name is Steve, and I'm a third-year medical student. Would it be all right if I had to chat to you about why you're in the hospital? I don't know about this, Nala. She seems pretty sick.
Steve, everybody in hospital is sick.
No, but she seems like really sick. She's barely opening her eyes. Why is that monitor making that weird noise?
That is weird.
Her temperature is 39.5. This lady has a fever.
Never know how much you urinate. Never know quite why you care.
But when he puts his arms around me, I get a fever that's so hard to bear. You give me fever. I was pissed at fever when he holds me tight. But in the morning, fever all through the night. Fever? Hypotension? Altered consciousness? Steve, I think she's in shock. Quick, call a rapid response.
A rapid response?
It means we need help. Go and press the big red button over there. I think this lady's in septic shock. She needs to be stabilized.
Should we leave Brittany? I mean Beryl alone?
Okay, first we need to stabilize her. Airways. Painted. Breathing. Oh, increase. Her pulses are fainted. She's very hypertensive. Reduce GCS. Oh, okay. Don't panic, Zazu. Don't panic. Just think. What would Mufasa do? Oh, he would know exactly what to do. Oh, he would first of all take some bloods, take a blood gas, and start on some fluids and antibiotics. So let's take her up to ICU. Okay?
Yes, Dr. Zazu, right away.
Oh, thank God. Steve, Nala, thank you so much for calling the rapid. Okay, quick, go find Dr. Mufasa and tell him what happened. And please don't tell him how stressed I was. Let's just keep that between us, okay?
Your secret's safe with us, Zazu. Time for a tea break!
Hey, you guys!
So, you just started your first year of medical school, is that right?
It sure is, Dr. Scar. We're so excited to be here. We get 1 day a year.
One whole day of placement a year? Well, that must mean you know everything there is to know, right?
Well, I mean, not exactly. We still got lots of
All right,
work.
we'll be doing some teaching with my surgical colleagues here. Dr. Shenzi is a general surgeon. Dr. Kamari is an obstetrician and gynecologist, and Dr. Ed... he's an orthopedic surgeon. You might want to speak a bit slowly when you talk to him, okay?
Right. First question. Describe the blood supply to the descending and sigmoid colon.
I
Well,
don't
do
know.
you know or do you not know? Quit stalling and answer her.
I don't know.
And you, what about you? Do you know?
I don't know. Newcastle Truly has let their standards slip. Okay, here's an easier one. In an anterior colporrhaphy, how many centimeters from the external urethral meatus would you incise to access the vaginal vault? We don't know. Okay, it's time.
Bone. Oh my God, you really should study harder. I mean, it's such a shame that when you're given the opportunity to prove yourself, you simply squander it.
Oh, and you, surgeons, what are you doing here? Are you intimidating the students again?
Oh, why, Dr. Mufasa, how nice of you to join us. I was just doing some teaching with these delightful little first years.
First of all, Scar, I'll remind you that this is my office. And second, I will not warn you again about intimidating our students. Would you two please excuse yourselves?
Oh, come on! We were just starting to have a little fun.
Yeah, Mufasa. What are you gonna do? Ims us?
Get out! Get out and crawl back to whatever theatre you came from. Scar, you must know why I've called this meeting. Your behaviour on ward rounds this morning was completely inappropriate, and it's not the first time. I am sick of having this conversation with you.
Please save me the lecture, oh pious one. People like Mrs. Jenkins are the reason our healthcare system is under so much strain, and you know it. She will smoke and eat and drink herself to death, and there is nothing that we can do about it. As for the rest of it, I mean, you really should be more pro-intervention. How do you think this hospital pays for itself? If we operated more, all we'd have to do is sit back and let the money flow in.
Why can't you take this seriously? You know that's not how I run this hospital. We practice safe, evidence-based medicine, and that is not up for discussion.
Oh, being right is just so easy for you, isn't it, little brother? Aren't you just the golden boy? Pride of the college, you were always Mummy's favourite.
Oh, don't you bring Mummy into this.
But Mufasa, is it not true? I mean, everyone else might know you as the flawless director, but don't you forget, I know differently. Who helped you out during your training years when you had that little medication addiction problem, huh? Or who saved your life when you had an anaphylactic reaction to Lionocaine? Who performed CPR and who called the ambulance?
People make mistakes, Scar. And yes, I owe you my life. But that doesn't mean you can treat patients the way that you do. Not in my hospital.
Do you know what I find ever so fascinating? You have been promoted ahead of me at every twist and turn, following the path of other great men before you, but I can't help but think that if I wasn't a woman, perhaps I would have been the one to rise.
Scar, I have worked hard for my reputation and my patients and my career.
Oh, of course, I wouldn't dare imply that some of us have had an easier path than others, little brother. It's just that I want to be like you ever so badly.
You know what, Scar? You were never a candidate for this job. And a selfish, jealous doctor like you will never be the director of medicine here as long as I live. Oh, now look what you've made me do. You made me feel unwell. Get out. Just get out.
Of course, director.
Rafiki, my oldest, wisest friend.
Mufasa, my slightly younger, slightly dumber friend.
What?
What?
Huh? Did you say something?
No, I didn't. Did you?
Rafiki, I've come to you for advice before and I need it again. I am just so angry with her. What do I do?
You must think to yourself, what must I do? For I am so angry with her.
I didn't think about it like that. I'm thinking back to everything she's ever done, trying to find some silver lining.
No, you must look for a silver lining. You must think back to everything she has done.
You have such a way with words, Rafiki. How are you so old and so wise and so old? You just cut straight to the heart of the issue.
But what is the issue, Mufasa?
Well, I don't know, Rafiki. What is the
issue? The issue is you have forgotten your past. You have also forgotten your future. But more relevantly, you have forgotten your past. And in your past, she rescued you.
Mufasa, hey ya, hey Mufasa, hey Mufasa, hey ya, hey Mufasa.
Pride and your secrets in life falling. Mufasa, and her voice with her jealousy wild, asking, oh Mufasa, she rescued you, Mufasa. But her anger is growing, and I am scared what she will do next.
Wait. There's no vengeance that great. Hear my words and have faith. Whoa, have faith.
Hey Mufasa, hey Mufasa, hey Mufasa.
She rescued you. She made you clean. She saw your spiral, and she
Perhaps I have been unjust. She is my sister and a better doctor than I give her credit for. She rescued you. She rescued me. She stopped my spiral. She stopped your spiral. And she set you free. I must remember. You must remember. Remember the truth. I must remember. You must remember. She rescued you.
Now look what you've done. I'm feeling unwell. Well, there's an idea.
Hi, Dr. Scar. I'm really sorry to bother you, but have you seen Dr. Mufasa? We've told him there's one of his patients who's very unwell.
An unwell patient? Well, Dr. Mufasa's not here right now, but I'm sure I can pass the message along. Steve, why don't you tell me what's happened?
Okay. Well, today I had the pleasure of seeing Beryl, a lovely 87-year-old lady with suspected septic shock, secondary to...
That is absolutely splendid. 10 out of 10. Where did you learn such fine long case technique?
What do you mean?
You really need not continue. I mean, it's so obvious to me that you both have a gift. It's just such a shame you're not allowed to go and see patients on your own.
Wait, what are you talking about?
Oh, look. You didn't hear this from me, but I have to let you in on a little secret. This hospital is very underfunded and understaffed. Nurses are stretched too thin to look after patients on their own. And my heart, it just breaks for the surgical patients. No medication, no attention, no help. Not even a simple little cannula for their pain relief. Oh, look, I'm just tearing up thinking about it. If only someone could go to the surgical wards and give them a cannula. Oh, it's such a simple procedure, and I know Dr. Mufasa would be ever so grateful.
Well, we could do that.
No, but Nala, Dr. Mufasa forbade us from going into the surgical wards. We can't. Besides, faculty's banned us from doing any practical procedures. I've never even done a cannula before.
Oh, yes, Nala, Steve is absolutely right. You simply mustn't do it. I mean, even though it is an essential part of becoming a competent physician, and you both have to learn somehow, I guess Mufasa and the faculty just don't see it that way.
But that's so stupid. Patients are dying, and we could be saving lives. I'm sure Dr. Mufasa wouldn't mind in this case.
Well, I guess it would be good to learn.
Oh, excellent! All right, now there is a new policy that medical students no longer have to practice hand hygiene in the hospital. Only nurses do. All right, think of how many cannulas you can get done now without even having to worry about washing your hands. All right, good luck.
But Nala, the nurses just told us how important it is to wash our hands. That doesn't sound right.
You are so naive sometimes, Steve. Who do you think knows more around here? Dr. Scar or a few nurses? Come on, let's go.
Damn that lousy Mufasa. Who does he think he is kicking us out like that? I think he knocked something loose up in here. What are you laughing at, Ed?
Yeah, Ed, you're an orthopod. You barely even qualify as a doctor.
Hey! You're talking about Ed! Oh, you're gonna make Ed angry!
Jeez, you two, would you knock it off? Look at you. It's no wonder we're dangling at the bottom of the medical food chain.
Oh, I hate those bloody physicians. They think they're so clever with their stethoscopes and their tendon hammers.
But you know what they do have? Money. All those fancy tests they order must cost a buttload. And to think, as soon as we do even one operation or procedure, they're all like, no, Dr. Shinzi, I don't think it's such a good idea taking out that patient's entire large intestine.
Or should you really be delivering that baby at 25 weeks gestation, Dr. Kamari?
Yeah, and when they're all like, hey, Ed, don't do that thing you always do.
Yeah. Yeah, why have they got to tell the patients what's best for them, huh? You know what they are. Snitches!
Snitches?
Yeah, snitches! I'm sick of never getting to do any procedures and never getting any money. I mean, I've got kids to feed too, you know. And by kids to feed, I mean luxury sports cars to buy.
It's about time we got some more procedures around here. We want more surgeries. Who's with me?
Yeah!
Yeah. Yeah. Yeah.
Ayo, dayo, moolah, ayo. Snitch better have my money. Only diamonds not the rough. Snitch better have my money. No, we cannot get enough. Pay me what you owe me. Forget about the bed you're on. Yeah, we're keeping tally. Let's get some unique hacks on. Like pop, pop, pop. Call it Johnny and it's all on me. Shit just will not stop. Ashkenazi, but it's cool 'cause we messed up on the stage. Just go pop, pop, pop. Shit, now you're on the backseat of the long and big black car. Don't think that we forgot. I'm on the spot, spot, spot. I need yacht, yacht, yacht. Pay me what you owe me. Don't act like you forgot. Snitch better have my money. Snitch better have my money. Pay me what you owe me. Snitch better have my. Snitch better have my. Snitch better have my. Snitch better have my. Turn up to the theater with a patient looking wasted. You say they're not fit for surgery, but you're just hating. Press the drum, every close up, maybe this was a mistake. And call a man, it's a rare had to set. Like pop, pop, pop. I'm the guy need level when your pee escapes, so it should not. If you ask me, some physio NDP is worth a shot. Shit, but take it out and I'll get paid with quite a lot. I'll tie the surgeon's gun. This mesh is hot, hot, hot. Like rub, rub, rub. Pay me what you owe me. Don't act like you forgot. Snitch better have my money. Snitch better have my money. Pay me what you owe me. Snitch better have my. Snitch better have my. Snitch better have my. Snitch better have my. Snitch better have my money. Don't act like you forgot. Snitch better have my money. Snitch better have my money. Snitch better have my money. Snitch better have my. Snitch better have my. Snitch better have my. Snitch better have my. Snitch better have my money.
Oh, no, I don't like this place. Dr. Mufasa told us we shouldn't be here.
Steve, it's a surgical ward. There's nothing to be afraid of. Remember, we're doing Mufasa a favor. Once he finds out we're helping with his workload, he'll probably offer to publish a paper with us. Just picture it. Nala. I'll be the first author, of course. Dr. Mufasa and miscellaneous medical student.
Wow. I could be that miscellaneous medical student.
That's right, Steve. And all you need to do is a few cannulas. They're super easy. Trust me. If an orthopedic surgeon can get a drip in, anyone can.
I've never done a cannula before. I don't even know what it'll feel like.
Here, I'll show you. First, it's all about preparation. Gauze. Whites. Bluey. Lights.
There you see it, a juicy vein right in her hand. Tighten up the tourniquet, go on, cannulate her. You see no reason why, and you're dying to try. You want to pierce her vein. Yes, you want it. Look at it, you know you do. It's possible that it won't fit. There's one way to find out. It should not sting. Make sure you get it in. Go on and pierce the vein. Sing with me now. Sha-la-la-la-la-la, my oh my. Looks like the boy's too shy. Ain't gonna pierce the vein. Sha-la-la-la-la-la, ain't that sad? It's such a shame. Too bad, he gonna miss the vein.
No, I don't know if I'm ready, Nala.
Trust me.
Are you sure?
Take my hand, like this. Feel it first, softly. Trace it. Deep breath.
Now's your moment.
Yeah, yeah,
Don't be scared, give it a try.
yeah, yeah,
Once you get the tip right in, just push a bit further.
yeah, yeah, yeah,
Give her you got no chance unless you gently, if that's what you
Here's the vein.
Sha-la-la-la-la, my oh my. Find the dark inside, now get it flushed in vein.
Whoa, whoa.
Sha-la-la-la-la, ain't that great?
Whoa, whoa.
Sha-la-la, if you forever change, so you must just forget the light in the vein.
Whoa, whoa.
Sha-la-la-la-la, don't delay, take off the tourniquet. Now that you pierce the vein. Pierce the vein.
Oh my God, Nala. My heart's beating so fast. Does it always go like that every time you put one in? I mean, every time you do any procedure?
Every time? I guess that's why I love doing it so much, that thrill.
Yeah, I know what you mean. You're a really good teacher, Nala.
You did really well too, Steve. Never seen someone so good in their first try.
You really mean that?
Yeah, I guess I do. Come on, Steve. Ready to go for round two? Oh, that patient over there doesn't have one either.
Yeah, of course. Yes, but shouldn't we clean up all this mess? And shouldn't we wash our hands as well?
Remember what Scar said. We don't need to worry about that. Just grab the equipment and let's do the next one.
All right, here goes.
No hand hygiene. Infection control risk. Spread of hospital-acquired infections. Disobeying infection protocol. You two are under nursing arrest for gross, and I mean gross misconduct.
What are you talking about? We're medical students. We're exempt from that hand hygiene crap.
This crap you're talking about, young lady, is one of the main tenets of hospital nursing.
Always obey the 5 moments of hand hygiene.
But Dr. Scar said that there's new hospital policy, that we don't need to do any of that stuff anymore.
Whoever told you that was clearly lying to you, foolish student!
It's about time you worked out how this hospital works.
Welcome to the jungle, students. For this grievous crime of forgetting to wash one's hands after an invasive procedure, I have no choice.
Oh my God, she's gonna do it.
Yeah, she's gonna do it.
But to call the nun.
No, please don't call the nun. I was was just a little misunderstanding. We won't do it again.
Yeah, what a funny joke Scar played. We'll just wash our hands and we'll be on our merry way back to the medical wards.
It's too late for that now. I have to call her. Num 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 num.
Nothing happened. Shows what you nurses know. I told you, we did nothing wrong. Just wait until Dr. Mufasa hears about this. You're all gonna wish you stayed on tea break. Permanently. Right, Steve?
Nala, I think we probably should have just washed our hands.
Who didn't wash their hands after performing a medical procedure? I'm gonna have to teach the both of you a thing or two about hand hygiene, huh? Hit it, boys!
almighty known. We'll always wash our hands now. We promise. I'll never forget to alcohol gel as long as I live.
I will forgive your insolence this once. But if either of you ever forgets just one of the 5 moments of hand hygiene, you can consider your future careers over!
Enough! What is this, rat? What are you two doing here? You've deliberately disobeyed my orders. This is not my jurisdiction. If the surgeons had caught, there's no telling what could have happened. I'm not mad. I'm just disappointed. You two were both my responsibility, and if something had happened to you, I never would have forgiven myself.
Dr. Mufasa, are you okay?
I'm okay. It's just a stomachache. If I'm not mistaken, you two have teaching with Rafiki the radiologist in 10 minutes. Pay attention to him and listen carefully, because he is very wise and very old.
Dear Dr. Mufasa, regarding patient Jane Doe scan CT brain without contrast. Stop. Every day, the tumor is growing bigger and more beautiful, and someday will make us all very proud. Stop. Delete that. Every day, the tumor is growing bigger and stronger. Stop. I am very worried. Stop. Things are not looking good. Stop.
Rafiki? Here.
Who are you?
We're the medical students. I'm Nala. This is Steve. Dr. Mufasa said we had teaching today.
What? Teaching? That is the plan? Are you crazy? That will never work. I cannot teach you anything. Now, I don't want you here. I am very, very, very clearly busy.
In that case, we're sorry to bother you. We'll leave.
No. It's okay. I will make teaching work. Now tell me, what is your destiny?
My destiny?
Yes, your destiny, of course. You must know what your destiny is. Otherwise, how are you to make it work? Or is it the case that the destiny does not exist and that you make your own path?
I don't know. Which one is it?
Which one is it? I do not know. I am a radiologist, not a magician. I can only describe to you the things that I know and the things that I have seen, but it is up to you to interpret the truth within my words. If you are ever struggling to see something in the darkness, to spot something small on a film, you come find me. You follow old Rafiki, he will show you. But do not ask me to make sense of anything, because I can't. And I shan't. I think that is enough teaching for the day, don't you? Goodbye. Now, where was I? Dear Dr. Mufasa.
Nala, what do you think he meant about destiny?
Steve, you don't need to be a genius to know that all radiologists are total nut jobs. There is a reason they stay in the dark all day. Everybody knows Rafiki makes no sense. Look, Zazu wants an ED in 10 minutes. Finally, some real action. Come on, Steve, let's go.
I just can't stand that Dr. Mufasa. He's just so boring and evidence-based.
Oh, just hearing that name makes Ed's bones quiver.
Mufasa! 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 Mufasa!
Silence! Enough! I am surrounded by idiots. Do you know what I find ever so perplexing? Surgeons are renowned for their capacity to get the job done. And yet, ever since my little brother, Dr. Mufasa, and those damned medical physicians came into power, we have been treated like second-class practitioners.
Well, what are we going to do? Get Mufasa to leave?
Why, Ed, I think that is the smartest thing I think I've ever heard you say.
Where will he go?
Somewhere
somewhere nice? No, you moron. We're gonna overthrow him and we'll pin it on someone else.
Yeah, who needs a director?
No director, la la la! You fools! I will be the director. Work with me, and I promise your referrals will never dry up again.
All right, private billing. Let's go. Private bill.
How will we ever throw him? Malpractice suit? Maybe he's sleeping with a patient?
Let's break his legs.
My surgical associates, don't you worry about my little brother. Be prepared. I know just what his weakness is.
Finally, the emergency department.
Oh, no. Zazu does not like this place. Oh, you can feel the tension in the air. All it takes is one extra bit of medication, one sign or symptom miss, or one piece of information not recorded, and that's it. Come on, the patient's dead. Stop it, Zazu. You're sharing too much again. You can't let Mufasa see you like this. Remember, your cats need you to stay strong.
Incoming patient, resource 1. Incoming patient, resource 1.
Resource 1? This sounds bad. Steve, Nala, prepare the area for the incoming patient. I'll go get Mufasa.
All right, Steve, glove up.
Good evening, ladies and gentlemen. Here we got a 54-year-old male who presented with the sudden worsening of a 6-hour history of abdominal pain. He's also complaining of some nausea and some vomiting. Isn't that right, buddy?
It's Dr. Mufasa?
We've started IV fluids and given some analgesia. He's also got a C-spine collar, bilateral chest trains, and a pelvic binder, just in case. No medical history, no smoking, no alcohol, but he did say he was allergic to...
All right, I'm sure you guys can take it from here. We've got to go. Newcastle needs us.
Dr. Mufasa, are you okay? What happened?
Steve, this is worse than I thought. He must be really ill. We need help. Like now.
Maybe we could call a rapid response. That way everyone will come running in like last time.
That won't work this time, Steve. In ED, we're the rapid response. It's okay. Just stay here. I'll go find Zazu or a nurse or someone to come and help us. I'll be back before you know it. But, Steve, if something does happen, you can do this. You are one of the smartest third-year medical students I've ever met. It's about time you showed everyone what you've got.
Mufasa. Okay. Think, Steve, think. What would Mufasa do? Okay, first I need to check his vitals. Pulse. Heart sounds. Respirate. Okay. Next I need to give him some pain relief. But what? And how much? Oh, I need to check his chart online. Oh, but where's the computer?
Steve, what on earth are you doing here alone? Where is Zazu and that female medical student?
Oh, thank God you're here, Scar. It's Dr. Mufasa.
What?
He's come into emergency with abdominal pain. He's been vomiting and passing black stools, and it's...
God, abdominal pain, severe nausea and vomiting, black tarry stools. Poor Dr. Mufasa must have a perforated gastric ulcer. It must be from all that stress he's been under recently. And you know what, Steve? What an excellent job you've done in managing him so far. You truly are one of the brightest medical students I have ever met. All right, now what pain relief options do we have?
Oh, I mean, we could use the analgesia ladder. We could start with something like paracetamol and work our way up.
Oh, come on now, Steve, think. Would you really want someone dilly-dallying around with one of those pain relief ladders when he's shitting out blood? Come on, think! Something we inject, perhaps.
Gee, Scar, I'm not so sure. I mean, we could inject him with some local anesthetic or something. What about Lionocaine?
Lionocaine? That sounds like a great pun. I mean plan. Now, Steve, you go over there and draw up some Lionocaine, okay, and inject it into his abdomen. That'll buy us some time. I'll go and get some fluids, but you stay with him, Steve. Don't let him crash, okay? Hurry.
Oh, yes, the Lionocaine. Okay, so the maximum dosage would be about 3 milligrams per kilogram. So for Mufasa, that would be about 300 milligrams. So this vial is only 100 milligrams, so I'm definitely safe to use the whole thing. Okay, last thing, check for allergies. No allergies, looks like you're ready to go, Mufasa. Mufasa? Hey, Mufasa, wake up. Oh man, I think it's crashing. Guys, is anyone there? Please help. Okay, Steve. Okay, you got this, Steve. Okay, Mufasa. Looks like it's time to bring you back from the dead.
Where am I? What happened?
Oh, thank God you're here, Mufasa. It worked. I saved your life.
What? What have you done?
Scar told me to inject you with Lionocaine. It
Scar
worked.
told you to what?
Scar told me to inject you with Lidocaine while he went to get help.
Give me the adrenaline.
Are you okay? What do you need? Mufasa, what do you need? Are you okay? Hey, Mufasa! Mufasa, wake up! Stay with me! Mufasa, please wake up! Help! Somebody help! Please!
Steve, what on earth have you done? What's happened?
I gave him the drug, just like you said.
You did what? I told you to wait until I got back. What did you give him?
I gave him the Lidocaine, like you said.
Lidocaine? That was your idea. I told you to wait until I got back my poor little brother. You must have given him too much.
No, I can't have. I only gave him 100 milligrams.
That can't be right. Look, you've almost killed the director of the hospital.
Oh, what have I done, Scar? What do I do?
Steve, there's only one way out of this. You have to run away. Run away and never come back.
Run away, but my parents are back in Armadale. If they find out what happened, it'll break their hearts.
Oh, sure, stay. Picture it now. Inexperienced medical student kills nation's finest doctor. It's got a nice ring to it, doesn't it?
Oh, crap. You're right, Sky. I have to go. I have to run away.
You're making the right choice, Steve. Run away, start anew, but whatever you do, don't come back.
Is this the real life? Is this just fantasy? Mufasa's passed on. Someone erased his allergy. Open your eyes. Look inside his chart and see.
I'm just a student. What has Sky done to me?
Easy come, easy go. You've been played, did you know?
Wherever my career goes doesn't really matter to me. Mama just killed a man. Wasn't careful with his meds. Pushed the boneless, now he's dead. Nala, our time had just begun, but now I've gone and thrown it all away. Mufasa, I didn't mean to take your life. Now all I feel is overwhelming sorrow. What have I done? What have I done? Right, wrong, wrong.
shattered. It's too late, my time is gone. Dark, the sky is right. I have to leave this place and hide. Goodbye, everybody. I've got to go. Gotta leave you all behind and face the truth. Sonia, I know you said you wanted to try. I find by now I wish I was at the
I knew that man. Where was the bracelet on his hand? Gospel truth, someone have a really shot. No suspicion of hiding. Have we done the right thing? There is no way out. We cannot stay. We have to pay the price and go.
I'm just a student, nobody trusts me.
He's just a student from the JMP. Spare him the fee, let him have his degree.
Easy come, easy go, will you let me go?
Lion, no, we will not let you go. Let him go. Lion, we will not let you go. Let him go. Lion, we will not let you go. Let him go. Will not let you go. Let him go. Let him go. No, 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 no.
Oh, gonorrhea, diarrhea.
Gonorrhea, let him go. Teacher, while he has a pregnancy sing aside. For Steve, for Steve, for
All those years of last offer, you ripped up my pride. Now you're dead and I found my perfect full guy. Mufasa, you can touch me, Mufasa. So you better get out, so you better get right out of here.
Bright rock will be shattered, everyone can see. Bright rock will be shattered, this town will be in tatters because of me. Who knows where I will go?
a.m. Operations commence at 4:30. I expect punctuality. Chart! But here I am, teaching and inspiring the next generation. All right, febrile overnight, theatre for an abscess drainage, first on the list. Hold on a minute, anything to eat or drink? Good!
What? No! I don't see any fevers recorded on here.
Just leave it now. There's no time. We'll lose her.
Hold on a minute. Where are your new IDs? We start early so the surgeons can perform as many procedures as possible that day. I believe it is all about efficiency. We give the customer, the patient, exactly what they need. All right, have you debrided a wound before?
No.
All right, well, today is your lucky day. Sign here.
Dr. Scar, the patient's lung function tests have come back and I don't think he's quite fit for surgery.
Not fit. Not fit! Oh, my junior, naive, incompetent colleague! There is no fit or not fit. Surgery is the only option. Something not good? Cut it out. It's that simple. The more procedures we perform, the more money that the hospital gets. All right, we're running late. Who's next? Oh, bed 7, you got a new kidney yet?
Oh, I don't think so.
All right, and who's this new patient over here?
It's such a terrible story. 18-year-old male, motor vehicle accident. God, he was so young. Non-drinker, non-smoker, elite athlete. He had his whole life ahead of him. Any broken bone, ruptured spleen. Is he pregnant? No. We've done everything we can, but we can't seem to get him off the ventilator.
What a shame. I got a feeling that patient's not feeling or responding at all today. It's the machine that's breathing, and that's just cheating. So expensive, I don't know who's gonna pay. So the only solution to keep that patient from death, let's take that healthy kidney, 'cause they're already dead. Turn it off like a light switch, just go flick. It's a cool little transplant trick. We do it all the time when you're feeling kinda guilty, thinking that ain't right. Treat that ventilator like a reading light and turn it off like a light switch, just go back. Really, what's so hard about that? Turn it off! Turn it off!
But Dr. Scar, should the decision be up to the patient's family? I'm sure Charles Douglas would find this very unethical.
No, 'cause then you're just keeping it down like a viral load on low.
On low.
Thinking nobody needs to know.
Uh-oh.
But that's not true. Being sick is bad, but brain dead's worse. So they should realize our bottom line's being hurt and turn it off. So how do you feel?
Same.
Oh, well then you've only got yourself to blame. It's really not that tough. Just sit the family down and say treatment is futile. Pick your favorite organ and take it. Okay.
Dr. Scar, the patient's antibody free.
It's a match! Yay! Turn it off! Turn it off! Turn it off, like a light switch. Go click, click, click. It's a cool little transplant trick, trick, trick. Do it all the time when you're feeling kinda guilty, thinking that ain't right. Treat the ventilator like a reading light. Turn it off like a light switch, and they're gone. Now they won't breathe any.
Makuna Matata Flower Shop. Morning, Seamus McClover. How's it growing?
Top of the morning to you, lassie. Say, I must be the luckiest leaf in the world to be potted next to you, Scarlet Rose.
Oh, please, Seamus. My rosebud's not just for any garden variety guy. No matter how thorny I make your little clover, my sweet scent will never be for you. But me and Wally over there, I'm certain we'd be good together.
Whoa, where am I? Oh man, I totally wet my plants last night.
OMG, you are such a pot plant head, Welly Weed. You should really start detoxifying all this negative energy from your life. Like I tell all my flowers, it's about creating a positive energy. Hashtag live, love, laugh. Hashtag love yourself. Hashtag Sabrina Succulent.
Oh God! Achoo! Which one of you guys is blooming right now? Achoo! You know how bad my hay fever gets. Achoo!
Oh, nip it in the bud, Danny. Nobody's slipping pollen anywhere. But if you did want to pollinate, this sunflower's always open.
Oh my God, you two. You should totally get clovered and just fertilize each other's soil already. What about you, Seamus? I'm totally ready to turn cacti into cactus.
Oh, you're a real prick, Sabrina. You just want to kiss me because I'm Irish, don't ya?
You guys, please, achoo! Stop this. My eyes are getting all red and achoo! Watering.
Damn, your eyes are red too. Man, I totally know how you feel.
Something else is a little red too, Wally, if you know what I mean, honey.
Did someone say honey? Buzz, bitches!
Oh my God, it's a bee!
A bee!
He's here to pollinate us again! For the love of God, this is unbelievable! Make it stop!
Hey there, flowers. Now, I know what you're thinking. Horizontal stripes are so not my thing. Hello, fashion police. I'd like to report a crime. Prime suspect, me! Oh, I'm just dying to pollinate someone. I just don't know who.
Oh, please pick me. I haven't flowered in so long.
You can prick me with your stinger any day, honeybee.
I mean, I'm looking totally succulent today.
Oh man, I'm totally tripping out.
Hey there, dandelion. You're looking fresh as a daisy today. I wouldn't mind pricking you with my stinger. Ooh. You're looking dandy and I'm not lying. All right, here I come. Buzz, buzz, buzz!
No more pollen! No!
Wait! Here comes a new fella. Everyone, act natural.
Wally.
Achoo!
I wanted to be a doctor there, so freaking bad. Now I really wish I never had. I've given up on medicine, I don't give a damn. Now I don't know who I truly am. I want to leave it all behind. I can't shake none up from my mind. Oh, a different life I need to find. Oh, I swear I'm done, I do not care. I ain't going back there.
Oh my
Steve, Simone.
Oh, so funny.
Oh, gee. Oh, gee.
Hey, Steve. Buddy. Why the long face?
Yeah, you better not be pining over some girl.
Remember, you came here to leave your old life behind. Be free. Be reborn.
Yeah, look, there you go, sweetheart, okay?
I know. Please believe me, I really am grateful to you and Simone for welcoming me and giving me this job in your shop. It's just that, I don't know, ever since I was like 10, I wanted to do medicine. But I guess I'm just not cut out for it. It's not meant to be.
Jeez, he's looking real blue.
Well, I'd say more of a tan.
No, I mean depressed.
Okay, blue, depressed. Well, that doesn't make sense, does it? No.
Hey, Steve. Buddy, you never told us why you ran away.
It doesn't matter. I did something terrible. I can't go back.
Yeah.
So you're an outcast. Well, so are we. And Paul and I, we can tell ya, it's the best thing that ever happened to us.
When the world turns its back on you, you gotta turn your back on the world. Be stress-free and carefree. You know, before Simone and I opened this shop, she was a banker, and I was a lawyer.
No way. What happened?
Why? When she was a young lawyer.
When I was a young lawyer.
Very nice.
Thanks.
She found the courtroom like a certain appeal. Defending the guilty wasn't part of the deal.
I'm a hard-working soul, but I packed it in. Stress and late hours. There was snow on my chin. And all the shame.
Stay with the shame.
So I quit the law game.
It was never the same.
And with a magic touch.
That weight was lifted.
Now I just don't give a
Paula!
Yeah.
Not in front of the kid.
Oh, sorry. Where was I?
But wait. But what's your story, Simone? You said that you're an outcast too. Why are you here?
Why? When she was a young banker.
When I was a young banker.
Oh, very nice.
Thank you.
She found corporate ethics were less than ideal. Billing debt clients was oddly surreal.
That kind of work takes its toll. So I packed it in. Then I knew if I stayed, I'd retire next spring.
We grow marijuana. What a wonderful craze. We grow marijuana. Sit back and get blazed. We got no worries for the rest of our days. It's the THC. We feel so free. We grow marijuana. Hakuna Matata. Hakuna Matata. Hakuna Matata. Hakuna Matata. Hakuna Matata. Hakuna
Now listen, kid. If you want to work with us, you got to work with us. You get what I'm saying? See, Paul and I, we like you, and we like to let you in on a little secret. See, Paul and I, we're what you might call entrepreneurs.
Yeah.
We've been selling all kinds of weird and wonderful plants since we've realized a large number of our customers, well, they have an interest in somewhat alternative medication.
Yeah, you know, the florist run, it's really good for business. It makes people think they're getting a natural health boost. And it's so much better than sitting at the GP with people coughing and sneezing everywhere.
Oh, wait. But isn't this wrong? You two don't know anything about medicine.
Medicine?
Medicine.
Oh, we don't need to know any medicine, Steve. In fact, it helps that we don't.
Yeah.
You see, our customers, the good people that come in here to buy bottled mountain air or willow block, clearly don't want to know or hear anything about actual medicine.
Yeah, and you know, it's not like we can do any real harm. Best case scenario, a little wild lettuce extract helps with constipation. But if it doesn't, at worst, we've sold a harmless placebo.
Yeah, I guess.
All right, let's show you how this is done. Ladies and gentlemen, rush in now for 50% off all natural remedies. Are you feeling any less healthy, vibrant, or alive than you did at age 18? Let us help you. Balance your hormones, align your chakras, and recharge your chi. Stock up on vitamins, tonics, detoxes, and cleansers today. Whether you're into aromatherapy, naturopathy, iridology, reflexology, herbalism, sadomasochism, Reiki, or just good old-fashioned homeopathy, have we got something for you?
Oh, hello, Doris. How are the grandkids, huh? You thought Hip's not giving you too much trouble, I hope. Say, did you get in touch with that crystal dealer I recommended? Yeah. Ah, good. How can I help you today?
Well, I'm finding it a wee harder to, get to sleep, though. Insomnia is a terrible thing, Doris. I bet you're stressed.
Yeah.
Are you stressed? Doris!
Stress? No. I'm happy and I'm retired.
Oh, no. Doris, hit stress. Try this mix of passiflora, hops and valeria, okay? 8 times per day. That should do the trick. Okay. Next.
Oh, Steve, did you see that? Did you see how it's done?
Yeah, you just ripped off a lovely old lady?
No. The customer came in seeking advice, and we recommended an appropriate, wholesome, natural therapy. They're happy, we're happy. It's good business.
Oh, hello, good sir. How can I help you today?
Good day. My doctor said I needed to get some pills for this here diabetes, but you see, I don't really trust Big Pharma.
Ah, no. Well, you've come to the right place. Try our Sugar Balance Blend. It's a mix of fruit powder, leaf powder, gunpowder, fruit powder, and some more fruit powder for good measure. Hence, if you want it to work extra well, try 1 drop in a bath full of hot water, and then just inhale the steam. But
make sure you also seek and follow the advice of a qualified medical practitioner. Do not substitute or replace prescribed medications with natural alternatives without first discussing it with your lawyer.
Okay.
Do you see that, Steve? Hakuna Matata. There's nothing to be worried about.
Steve, I think it's your turn.
Okay. Hi there, my name is Steve, and I'm a third-year medical medical student, and first-aid naturopath. How can I help?
Yeah, look, I need help with my acne real quick. I've got spots everywhere at the moment, but my face, it doesn't like normal face washes either.
Wait, sorry.
And I'm vegan.
Wait, do you have any allergies? Could I just check your name and your age as well?
Steve, get to the point. My dear, has anything worked for you before?
So I used to use a salicylic acid-based wash for a while that seemed to work, but it wasn't organic or natural, and I'm vegan.
Wait, salicylic acid. Paula, do we have any willow bark? I remember from med school that willow bark is a source of salicylates, so it should work in the same way for you, but without the preservatives. Any problems, and you stop immediately, okay?
Okay, thank you.
Well done, kid.
Yeah, well done. Now, let's speed this up. Constipation, coffee enema.
Eczema, tea tree oil.
Headaches, ginseng and mung bean.
Cough, licorice root.
Dizziness, basil.
Joint pain, turmeric.
Cancer.
Oh.
Well, have we got something for you?
I am an advanced trainee of internal adult medicine. 5 years of med school, 2 years of junior, and 6 years of registrar. You can totally do this, Zazu. Just because Scott just totally exiled you to Bathing Suite, the one place you swore to never step foot inside again, doesn't mean you still can't be a brilliant doctor who thinks ahead and has a plan for everything, right? Oh, shit. For Mufasa! God, I'm coming! Oh my God!
Oh my God, it's coming! It's coming! Oh, where's the doctor?
Oh my God, I'm here, the doctor! I'm here, Dr. Zazu, and you are...
Giving fucking birth!
Oh.
I'm crying now!
Okay, so I can say that. So I'll be delivering your baby today. Oh, congratulations! How exciting! What a miracle! Oh my God! Oh shit! Oh shit!
Sherry, this is all your fucking fault!
Shit.
It's popping! It's popping! Get it out!
Oh my God! I have your baby! Oh God, take your baby, please! Oh my God!
I just saw my baby brought to life. He was warm, he came alive, back us 5 at 9. He showed me what it was to cry. Well, I've never felt so much pain before. He came through with me in two, that's for fucking sure. And now I'm bleeding on the floor. There's nothing where it used to lie. My epidural has run dry. It just feels so wrong. My vagina's torn. It's so much pain. This is how I feel. Cold night and pain. I can take it on all fours. Never so damn big. It's never gonna heal. Screaming out and I can see my perineum's torn. You're a little late. I'm already torn. All these other mothers just tell lies. In the end, you hold your child and it'll be alright. But he plowed right through my pelvic floor. What's left there? It looks so fucked. You wanna stitch it all back up? Is this gonna sting? But please don't touch your door. And I also shut myself. This is my life now. I'm cold and I am ripped with my placenta on the floor. I knew there would be pain. This is something else. Screaming out and I can see my perfect child is born. Looking at your face, I'm so glad you're born. I'm cold and I am ripped and I can see my vag is torn. You're a little lady, I'm already
Simone,
Yeah.
you ever wonder how sparkling water with a slice of lemon every morning, how that actually balances body pH?
I don't wonder, Paula. I know.
Oh. How?
It's the bubbles, Paula. And everyone knows that bubbles, well, bubbles align. And they stick. You know, chemistry.
Steve, what do you think?
You guys are just cooked. Listen, it's closing time, and I'm gonna go home.
Okay.
All right. I'll see you guys tomorrow.
Bye.
Oh, hi there. I'm looking for an immune booster.
Oh, well, you've come just to the right place. Our all-natural immunogenic Ultra Mix is just the thing. You'll be fighting for it in no time.
Oh, no. It's not for me, see, it's for my son. He's just breathless and he's got this temperature. Yeah.
Oh, no, that's no good. A barking cough? Anyway, here, take this and make sure he drinks plenty of water, and that'll be $10.
Okay, wonderful. Thank you
Thank
so
you very much. Have a nice day. Gosh, that cough doesn't sound too good. Wait, barking cough, fever, increased work of breathing, croup, it's croup. Excuse me, miss, I'm sorry. I think your son has croup. It's a dangerous infection of the airway that can be fatal if left untreated.
You've just given me the...
Yeah, look, Steve, you can't do much better than the Immune Ultra Mix, okay, buddy?
Yeah, ma'am, don't worry. It's full of vitamins and well-aligned chakras.
No, stop! Listen, he needs real medication. He needs steroids to help him breathe. Please take him to the hospital. This stuff won't help. Please.
Oh gosh, okay, we'll go there right now. Thank you so much. Thank you.
Wait. What was that all about? How could you lie to that poor mum?
Why? I was just trying to do my best to help. The Immune Ultra Mix is great body support. It does wonders for subclinical autoimmune disease.
That kid, he would have died. And it would have been our fault. These people, they trust us to help them. And that means knowing when to admit our failings. Most of what we sell is harmless crap, guys. But if we keep pretending that we can cure things we can't, that's fraud. And that's dangerous. I thought you guys were better than shamquacks. You could have killed that kid.
I can't believe you could see the intestines moving right in front of your eyes. It's incredible. We literally just cured that guy's cancer. He had cancer in his bowel, we cut it out, and now he can go home cancer-free. It's amazing.
Why, yes, Nala, it looks like you've caught scalpel fever, and lucky for you, now that I'm in charge, my surgeons are performing more procedures every day. You'll be able to practice and develop your skills like never before. All right, the next patient's anaesthetized. You want to remove an appendix?
Yes, please. Wait. Dr. Scar, the next patient's coming in for a hernia repair. There's nothing wrong with her appendix.
Oh, sure, that may be true, but what is one of the first rules of medicine? There are no certainties. She could have the very beginnings of appendicitis. Besides, we're going in there. It's up for grabs. She won't miss it.
I guess so.
And you get double the surgical experience. Everybody wins, all right? Dr. Shenzi and I are going to go and get coffee. I want you to start the next case, divide the fascia, and free the sac all before we come back. It's very simple stuff and a great learning opportunity. You have seen one of these, haven't you?
Well, yes, I saw one this morning, but I don't think I'm quite comfortable forming one on my own yet.
Oh, nonsense. See one, do one, teach one. You're flying solo for this one, Nala. All right, now hurry up and get in there, and don't worry about that scrubbing nonsense.
Steve, why did you stay calm for once instead of flying off the handle? I hope you're happy. I hope you're happy now. I hope you're happy how you've heard our feels forever. I hope you think you're clever.
No, I hope you're happy. I hope you're happy too. I hope you're proud how you would peddle in deception. You aren't even a physician. So though I can't imagine how, I hope you're happy right now.
Steve, listen to me. Just say you're sorry. You can
promise I can't do this anymore.
Something has changed within me. Medicine is not the same. See one, do one, teach one. Flying solo's not the same. Too late for second guessing. The patient's already fast asleep. It's time to trust my instincts. Check the site and leave. It's time to start performing surgery. My scalpel, my electrocautery, and you can't pull me down. Can't I make you understand? You have these delusions of grandeur.
Through accepting this guilt, 'cause someone tells me so. Some things I cannot change, but till I try, I'll never know. Too long I've been afraid of losing friends. I think I've lost, but this new life is something that must be higher cause. I can't deny that properly. There's a reason why I don't do things properly, and you can't hold me down.
Wait! Stop! This isn't me! My professional standards are better! Accredited. I've never been accredited. Why do I think I can do something I've never seen? And the dreams, the way I plan them, it operates in tandem. Things aren't right, we should begin. Pleasing when I'm home, surgery, all on my own. That's not how it's meant to be. I struggle with my gown. Well, is someone coming?
I hope you're happy now that you choose this.
Me too.
I hope it brings you bliss. I really hope you get it and you don't live to regret it. I hope you're happy in the end. I hope you're happy, my
Oh, don't you dare to spite me. I'm a determined guy. I've only realized lately I need to know just how fast I die.
And if I'm flying solo, at least we all agree. Life and limbs are in danger, accidental and key. It's wrong how I perform surgery.
I can't stand by this naturopathy.
Someone do up this fucking gown.
Guys, keep it down. Things have changed a lot since I left. No, we need to find out what actually happened that night and face the truth. I can't keep running from my past. But we need to do it quietly. I'm not sure what would happen if I showed my face around here again. Besides, you never know what surgeon could be lurking around any corner. Please keep it down. I told you, if anyone finds me before I get to Scar, I'll be sent so far interstate, it'll make the University of New England look like a romantic beachside getaway.
Gee, that does sound far. But what about us? We're not even qualified to be here. What if somebody sees us?
No, I've got it! What we need is a disguise!
A disguise?
A disguise?
A disguise! Now, what's something hospital-related that nobody would suspect?
Yeah.
Oh, I've got it! Quick, put these on! No one will suspect us if we look like surgeons! We'll blend right in!
Okay.
How do I look?
It's perfect.
Quick, someone's coming! Hurry up and put on some scrubs, Paula!
But there's no scrubs left. There's only this patient gown.
Well, hurry up and put it on!
But why do I have to be the patient? Why can't we swap?
I bought you guys this beautiful tea at the store yesterday.
Wait, what are you two surgeons doing here? And shouldn't you be in theatre?
Or draining some poor pensioner's bank account? Or spending time at home with your family?
But what are you two doing here? And which one of you let the patient out of the bed?
Oh, no.
Now, I haven't had a tea break in over 20 minutes, and I'm really starting to get annoyed. Which one of you let the patient out of the bed? I'm not going to ask again.
I'm a fraud. I'm not a real patient. And these aren't even real surgeons. This is all part of some elaborate plan to incriminate Scar in the poisoning of her brother and reunite Steve with his long-lost
I'm so sorry, nurses. This patient is with me. Myself and Dr. Scrubs here are just taking her up to the drainage of an infected anal cyst.
What?
She's completely delirious. You know how they get with these things. Isn't that right, Dr. Scrubs?
Huh? Yeah, what he said.
Oh, wait. Well, why is your patient still wearing clothes under her gown?
No.
And why do you look so young? You don't look nearly jaded enough to be a surgeon. Hey, wait a second. You're... Heaven is a place on earth. Time for tea break!
What the hell?
Oh, that was way too close.
Paula, how could you break so easily?
I'm sorry. They looked at me with murder in their eyes. I could feel their icy stares just boring into my very soul.
Nala?
Steve?
Who's she?
The female love interest protagonist. Keep up!
What are you doing here?
Nala, I came to find you, to tell you the truth about what really happened.
What do you mean the truth, Steve? I know the truth. You made a dumb third-year mistake and gave Mufasa too much Lionocaine, and now he's up in ICU in a coma.
No, that's not what happened. I mean, yeah, it is kind of what happened.
Over, Steve. What's done is done. And it's about time you took a good hard look at yourself and owned up to your mistakes. I've been working all day now with you, babe. Your medical knowledge impressed me. I thought that we could cannulate together always. I hoped you knew how to inject him right, to check his medication chart was tight. Oh, I should have taken him to theaters. I never thought that anyone could make me feel this way. But oh, that injection, oh my God, I can't believe I have to say, get out right now. It's the end of you and me. It's too late. I can't shake Mufasa is gone, and you know your dosage was too wrong, and still you keep on lying. You said that you would treat him right, but you were just a waste of time. I want wanted you on board with me. We met MD, oh what a team. But now my heart is breaking, got registered aching. I gave up long cases I had for some 30 years that wouldn't last. But I refuse to cry. How could I fall for these guys?
I never meant to hurt you. I should have told you what happened before I left. I'm sorry. It must be so hard doing medical rounds all by yourself, and so lonely with just you and Zazie.
Yeah, medical rounds. I've been going to them a lot.
Wait! Why are you wearing scrubs?
Yeah, only surgeons wear scrubs.
Who the hell are you two?
Simone and Paula, only the leads of Act 2.
Yeah, try and keep up, honey, okay?
These are friends I made while I was gone. I thought I could fix my mistake just by running away from it, but it only made things worse. No, I need to face what happened and deal with the consequences. But I know something else happened that night. I know it. That's why I'm here. I didn't do this. Wait, why are you wearing scrubs?
These are clinical clothes. What are you talking about?
You've been in theaters. You've been operating with those surgeons, haven't you? How could you do this, Nala? You know they only care about themselves and their bank accounts. How many times was it, huh?
It was only once.
Oh, once?
Twice.
Twice?
Okay, 8 times max, I swear, but it didn't mean anything. I was thinking about you the whole time.
Were they better than me? Just tell me the truth, were they better than me?
Well, I mean...
Enough! You two need to stop fighting! Now look here, Steve, if you think Scar was involved in Mufasa's accident, then we're gonna need all the help we can get!
You think Scar is involved in what happened to Mufasa? Steve, you just calculated the wrong dose. It happened.
No, I know I didn't. I know it doesn't seem like it, but you taught me so much, Nala. I calculated that dose so many times, I can't have forgotten. And Dr. Scar's been out to get us from the start. Remember when he sent us to the surgical wards? He's been trying to get rid of us.
Say what you said is true. How could we prove it? It's not like Scar is going to admit to any of this.
Yeah, that's where I'm a bit stuck.
Maybe we should talk to Rafiki. He did say he'd point us in the right direction whenever we needed help finding something. I'm sure that old guy must have something. Come on.
Dear Dr. Scar, regarding patient John Smith, scan CT abdomen with contrast. Stop. There appears to be a radio-opaque foreign object, approximately 3 by 9 inches in size, lodged firmly within the rectum. Stop. This is consistent with the clinical history of a soy milk bottle insertion right into...
Rafiki?
Yes? What are you doing here? We don't have teaching anymore.
Rafiki, I need your help.
Steve! Steve! It is time. I know why you are here.
How could you possibly know that? I think you're a little confused.
What? Me? Confused? No. I am not the one who is confused, my child. You are. You come to me searching for answers, for truth from the past. I already told you, boy. I cannot tell you the answers. I can only show you where to look.
And where is that?
Ah, where we always look when we need to find answers. In the imaging. Take a look at this chest x-ray. See how alive it looks.
But what is that white stuff over there? It almost looks like pneumonia?
Ah, Steve, you do not know how clever you are. Yes, this patient did indeed present with shortness of breath, fever, and purulent sputum. All consistent with a diagnosis of...
Community-acquired pneumonia. But what does that have to do with anything?
Ah, but Nala, you have just said the answer.
Community-acquired pneumonia. Mm-hmm. Community-acquired pneumonia. C-A-P. Cap! Ah! Steve, I know where we need to go. Come on. Woo! So, this is CAP, the Clinical Applications Portal. Basically, we find all our information on patients, including their past history.
Oh, right. So hopefully we can find something in Dr. Scar and Mufasa's past.
I applied for CAP access last year, so hopefully it's come through. Excuse me?
Welcome to the Clinical Applications Portal.
Access for Nala, 5th year medical student, please.
What can I do
Past medical history
for you?
Past medical history and previous admissions for Dr. Mufasa, thank you.
M R N
2253849.
Two. Two.
53849.
5.
3849.
Bzz. Bzz. B.
Oh, fuck.
What are we going to do? How are we going to get that file?
Dr. Mufasa is a current inpatient, so it shouldn't be too hard. Aha. Okay, let's start at the beginning. Previous admissions, appendicitis, age 12, hair transplant, age 35.
Wait, Nala, you're not going to believe this. Dr. Mufasa almost died when he was in med school.
Really? How?
His heart stopped and Dr. Scar did CPR and revived him.
What made him arrest? Brought him by ambulance, injecting college dorm anaphylaxis. Anaphylaxis?
Anaphylaxis? To what?
Lionocaine. It's a rare genetic allergy.
So, Dr. Mufasa is severely allergic to Lionocaine, and his sister, Dr. Scar, knows this and told me, a third-year medical student, to inject it into his veins, ultimately sending him into cardiac arrest and anaphylactic shock.
Steve, you didn't overdose him. Scar set you up.
So it wasn't my fault.
I'm so sorry, Steve. That bastard! Look, she deleted Mufasa's allergies from the system.
No, we need to tell everyone about this.
Wait. No, I have an idea. Come on.
D. 3.
Well,
Welcome to Pride Rock Grand Rounds, proudly brought to you by Kutcha and Neil. Thanks for the sandwiches. This week we have a special presentation from Nala, a fifth-year medical student, and Stefan, a biotechnology expert. Please make them welcome.
Thank you. Thank you. Now, today we're going to talk about cannulation. How many cannulas do you think are inserted every day in this hospital?
Oh, hundreds.
Successfully? Well, 0 by medical students. and how long does each one take, say, on average?
About 10 minutes or so, once you count all the preparation.
So that is hours of time every day that could be spent actually caring for our patients. And, Director Scar, you'll be happy to know that this means less time between surgeries putting in cannulas, which means...
more surgeries.
Exactly. Now, would you please join me up the front? I require a volunteer.
No, get one of those bedpans over there to help you out.
But whatever happened to Dr. Mufasa? Oh, what a great guy. I thought he was the director of this hospital. He would be up here volunteering without hesitation.
I am the director, and of course I will volunteer.
Fantastic. Now, this new cannula, we call it the Can-U-Mate, requires no setup, no tourniquet, and no bung attachment. It even has Lionocaine, coating the needle, meaning 0 pain for the patient.
Did you say Lionocaine coated?
Why, yes. Lionocaine. Isn't it incredible?
No, you can't. I'm allergic.
It's okay. There is only saline in the flush.
No, not the saline, the Lionocaine. It's a rare genetic allergy. I might die.
Genetic.
Oh, shit.
Wait, genetic? Does that mean Mufasa has it too?
Genetic? I didn't say genetic. I said eclectic condition.
But Lionocaine, that's what they gave Mufasa in ED. It was anaphylaxis, but it wasn't in the chat. They should have known.
Hey, Dr. Scar! Weren't you in the ED that night?
Scar poisoned Mufasa.
I take this job and put myself out on the line. Hurt my own brother, the thought never crossed my mind.
No, Scar, you poisoned him so that you could take him to the throne. You'd be rich, you'd be king, and you'd steal all of the earnings for yourself.
That's a lie! That's a lie! I didn't know he was allergic to...
Stop, please! Stop defending yourself. You knew he was allergic.
No, it was those surgeons. They did it.
The lie, this is all your own. The lie, don't stop to get your hands on all of the hands.
He ain't better than anybody. He ain't nothing but lucky.
Now listen to me, Scar. You've gone too far, and we put up with you for much too long. We have put up with your feelings, put up with your life, and all the malpractice.
Oh, but she was the one who put in the Lionocaine.
No, it was because that you had told me to. You used me, a medical student. Oh no, Scar, I was scared. Scar, I was scared.
We found Mufasa's records here on hand.
I knew you two were together. I always knew you two had it out for me.
Steve had nothing to do with this plan. It was you. You knew what it would do. You knew what it would do.
Enough! I will not sit here being confronted like this in shock.
Oh my God! That's Dr. Mufasa!
He's alive!
Stop now, sister. You've got to face what you've done.
Honey, you gave me no choice.
Quiet now, sister. You cannot do what you've done.
You owe me everything.
I said get out, sister. This time you've gone too far.
I wish that I went first.
We don't wanna work here like this. Only treating patients like business. We back out hand hygiene. We want doctors who care.
Ask you, stay in your lane.
Use a Lionocaine.
All those years I protected you. I was your sister. And now you're telling me it's all over.
Now the time is through. It's all over.
I nearly
You did it! I can't believe you did it!
No, Nala, we did it. We all did it. All of us.
Wait, I still can't believe what just happened. I'm still so confused.
So, Sky tried to usurp Mufasa's directorship and turn this hospital into an interventionist paradise so he and his surgical friends could line their pockets more.
Yeah, and this was all underpinned by the blossoming romance between Steve and Nala, which underscored most of the play.
Not to mention some zany characterizations by yours truly.
And don't forget the witty nurses.
And I guess I've realized something. You can't hide from your mistakes.
Oh.
I tried to run from my mistakes before. I even tried to turn my back on medicine altogether. But it's about having the courage to fall down, to get back up, and keep learning from your experiences. That's what makes you a good doctor. Treating my patients and helping people the best I possibly can is all I want to do with my life. I'm going back to medicine. Because as much fun as I've had with you guys, I just can't see myself doing anything else.
And I guess I learned that medicine, that life isn't always about being the best, about knowing the right answer, doing the most procedures. You can do all the surgeries in the world, that doesn't make you a good doctor. Being a good doctor is about being kind. It's about working as a team together. It's about being a teacher. It's about caring for all your patients equally, and I think that was definitely something I missed before. I still want to do surgery, but I'm going to do it the right way.
Well, everyone, I think that just about sums everything up.
Wait. Dr. Mufasa, could you please sign my logbook?
Actually, you'll have to take that up with the director.
The director? But I thought you were the...
I've decided to retire. You'll have to take that up with the new director. Director Zazu. Yes, you, Zazu. You see, what I've learned from being in a coma for the past act is that being a good doctor means really caring for your patients, and it means challenging yourself to do the things you never thought you could do, and it means teaching the people around you to do those things. And it might just be the Valium talking, Zazu, but this is why I'm handing it over to you. Congratulations on being the new director of Pride Rock.
Keep on learning and treating them all today. 'Cause we can No. When she needs her, she breaks down. Ooh, chocolate. Freeway is history. Be gone. It's never coming back. Never back. 'Cause tomorrow is a cannula and it's coming like that back. Spinning round and round, you look wrong off the stage till a cure is found. I'm lost now. I found the nurse so meant to be. We can't charge the seats, never since we first saw.